Filipinx American nurses, there was a report that was released by the National Nurses United in September of 2020, and they found that 1,718 healthcare workers died due to COVID-19 related complications. 213 of this number are registered nurses, and they're over half are nurses of color. And a very glaring data that they found is that 31.5% of nurses who passed due to COVID-19 related complications are of Filipino descent, despite the fact that Filipinos only make up 4% of the nursing workforce in the country. So, in order for us to understand why there are a lot of Filipino nurses in the country, we have to understand the relationship of the U.S. and the Philippines, right? So, if folks don't know, the Philippines was a U.S. colony from 1902 until 1946, after the Philippines lost the Philippine-American War. As part of the Philippines becoming a colony of the U.S., they established the first nursing school in the Philippines in 1907 at the Philippine Normal School. So as a result, we've seen this migration of Filipinos coming to the U.S. to work in different sectors, in agriculture and canneries in Alaska and Seattle. But we also see that there was this influx of nurses that was further encouraged by immigration policies, right? So we had the U.S. Exchange Visitors Program in the 50s, and of course the 1965 Immigration Act, which created the stipulations of skilled and unskilled workers to enter the country. So as a result, we see this large number of Filipinos that started entering the country through labor and also family reunification. So by post-1965, they actually found that the Philippines, which is true up to this day, has been one of the leading exporters of nurses to the U.S. In 2013, they found that 33% of foreign recruited nurses in the U.S. are from the Philippines. And it was actually over 40% before the 2008 recession, so it was higher then. And we know that with an aging population, right, that we're expecting that the current shortage of healthcare workers in the country, there is this expectation that the U.S. and other Western countries will continue to recruit Filipinos from the Philippines to work as nurses in the U.S. So, we've known this history of how Filipinx nurses have been recruited in terms of meeting the demands of different public health crises in the U.S. Dr. Catherine Saniza Choi at UC Berkeley wrote this wonderful book, Empire of Care. And one of the things she talks about is during the AIDS epidemic, the U.S. heavily recruited Filipinos to work in units that are serving patients living with AIDS. More recently, Jennifer Nazareno at Brown University published a study where they found that Philippine-trained nurses are more likely to work in 24/7 inpatient units with patients with higher acuity illnesses, more rotating shifts, and on-call hours compared to white U.S.-trained nurses. And earlier this year as well, the Philippine government was willing to offer Filipino nurses to work in Great Britain and Germany in exchange for COVID vaccines. So we've seen kind of this, how Filipino nurses have been in this vulnerable state in terms of how they're being used as a way for both the Philippine government to earn certain vaccines, but as well, right, the Philippine government is also benefiting a lot through the remittances of overseas Filipino workers, which include nurses. So, so I hope that this gives folks kind of an overview. Why are there a lot of Filipino nurses in the country? And also why it might explain this disproportionate number of Filipinx nurses who passed away due to COVID-19 related complications. So I'd like to introduce our panelists. I'm going to ask them if they could all just introduce themselves. So we'll go in order. If we could please have Iris C. Morelos introduce yourself.
Yes. Hello. Good day, everyone. My name is Iris Morelos. I am a critical care nurse in UC Davis, working in Tower 7 MSICU Blue, that was initially assigned as the COVID unit, one of the COVID units in UC Davis. Apart from being an ICU nurse, I'm also a mother of a 14-month-old baby and also a caregiver of my mom and dad, who's 82 years old. Mom is 75, who survived brain aneurysm with 3 brain surgeries. So I'm technically a nurse 24/7.
Thank you, Iris. And Gabriel C. Ortegoza, are you here with us?
Yes, Dale, I'm here.
Awesome. Thank you, Gabe.
So my name is Gabriel Ortegoza. I am a graduate of Central Philippine University, class 1991, which is otherwise known as the first nursing school in the Philippines, founded in 1906 by the American missionary. So it was used to be a name, Iloilo Mission Hospital. So again, that is the first nursing school in the Philippines, founded in 1906. And I worked at Kaiser Permanente, South Sacramento, for 16 years. And I said when I reach 50 years old, I will stop working at the bedside, which I did last November 2020. Now I'm back here in California. I spent like 5 months in the Philippines to start farming. I'm growing organic vegetable farming in the Philippines, aside from rubber plantation. So I'm back here for academic summer quarter at UC Davis School of Nursing for quarter school year until September 10, 2021. Thank you.
Thank you,